Good evening, Malaysia and followers from around the world. Our guest for tonight is Sri Dr Jemilah Mahmood. She has served as the Special Advisor to the Prime Minister on Public Health since March 2020. She is also the Under Secretary General for Partnerships in the International Federation of Red Cross and Red Crescent Societies since 2016. She was also the President of the Malaysian Medical Relief Society, or more commonly known as Mercy Malaysia to most of us. We are indeed privileged and honored to have Dr. Jemilah to share with us on her part in fighting COVID-19. And that we know that today, as we make this recording for this program, the numbers has been the highest since the pandemic broke out in Malaysia. It has been a grim day for most of us, and that as we continue the fight against the pandemic. I'm also pleased to have Tan Sri Johan Jaffar, my media comrade with me on many programs, to come in here to talk with Dr. Jemilah. Dr. Jemilah, welcome on board. I know they have been really busy. We spent a lot of your time involving in the vaccination program, but thank you for finding the time. As we entered the lockdown, Tan Sri, phase 1 has already started. It will take around 2 weeks. And if the situation do not improve, then we may have phase 2 for another 2 weeks. The health ministry has said that it will need at least 4 months to flatten the curve. Tan Sri, share with us what is our situation and what do we really need to do with all this situation staring at us badly.
Thank you very much, Dr. Wong, Dr. Johan. Lovely to be with you, and thanks for inviting me. Indeed, our situation is very grim. When we started off, we were doing really, really well. And then, since September, things have just gone south. I think it's a combination of factors. One is, there was a lot of complacency and fatigue from the pandemic. And while controls, we don't want full lockdowns all the time, we also did not see the behavioral change that we need among our people to really prevent the spread of the disease. I think also our public health strategy, could have been improved with much wider testing and isolation. And I think, now we're seeing the consequence of all that. So the exit strategy must be very clear for Malaysia. One is we have to comply with the standard operating procedures. We must rapidly scale up our vaccination programs because that's the only thing now that can help us to bring down the numbers rapidly. And then, slowly loosen the controls and have some form of normalcy returning to us, hopefully by the end of the year. I think that with the vaccination program ongoing and the ramp up, I'm quite optimistic that we will get there. In the meantime, it is not surprising that after every weekend, the backlog of the tests, this is when you get the peak, right? Tuesday, Wednesday is when you get, the lab results coming out, and therefore you get the numbers peaking at this point. So I just I don't want to be optimistic pessimistic or frighten people, but numbers are not the absolute thing that you look at. You look at mortality, you look at the number of ICU admissions, and that's what we should be looking at. So we can see that the mortality is rising, also because ICU admissions are rising. So we have to expect that for a while until we can bring the numbers down.
Tan Sri, how stretched out are our frontliners?
Very stretched out, very, very stretched out. The partnership with the private sector has been a great help to decant not just COVID patients, but also non-COVID patients. But it should have been done much, much earlier, in my opinion. But it is what it is. And now, we're in a situation where the private sector has to really step in. Where we can also improve is that we need to be better at, the contact tracing, keeping, we've got to use much more digital tools to communicate with people who have been diagnosed positive or maybe waiting at home to see what next. So I think this is where, I think we have to really improve. I have been supporting a lot of COVID positive patients on my own, those who are at home waiting. not sure what to do. So they call me or they text me, and I try to give advice. I tell everyone, and I'm not an agent for any of this, but I tell everyone, if you can invest, invest in a pulse oximeter, right? You can't see it because I'm using a background, but there you go. So buy a not so expensive pulse oximeter from the pharmacy or something. Don't buy one of these Shopee ones that will break down after 2 users. But I think it's very important that people know that if they have COVID positive, they're asymptomatic. If they have something to just monitor their oxygen levels, if it drops below 95%, really call for help quickly. I think that's going to be really, really helpful. What to do? Also, breathing exercises, sleeping prone, all these little tips that you can take if you are COVID positive and have mild symptoms.
Tan Sri?
Okay, Tan Sri Jemilah, you are the special advisor to the Prime Minister on public health. What actually do you do?
Okay,
if you don't mind.
That's a very good question, and I'm very happy that you asked me that. My main role is actually to look at health reform, not managing the COVID crisis. So when I returned from Geneva last year and had a conversation with the Prime Minister, what he wanted me to do was to look at how he wanted to make health one of the top priorities for his term. And he asked me to look at how we can improve the health system and health delivery in Malaysia, and using COVID as an opportunity to look at where those gaps might be and how we can then address them. So I am overseeing and is ready a confidential report on the health system, which because of my role, I'm neutral, right? I'm an advisor, and I have set up a committee with co-chairing it with the Secretary General of KKM, and then we are having a very honest look into our health system, and is ready for presentation to the Prime Minister. So that's my number one role. Number two is I provide some advice from my own experience managing public health in emergencies for 20 over years. I've been involved in so many health crises before, Ebola as well, and providing that advice based on global knowledge, on the field experience which I've had. And number three is looking at the vaccination program now. So the first part of the first year, I was really focusing on the health reform and a little bit of the COVID, but now I'm really just the health reform, and the vaccine program has been my real focus. So I work very closely with Yang Berhormat Khairi Jamaluddin on that. And then the other thing I do is the Prime Minister, what I advised him was to have an external advisory group for COVID, because it can't just be me alone advising KKM, because it will look as a very personal, disagreement when we have differing opinions. But to have a scientific advisory group like the UK and others that will talk to the Prime Minister, that's headed by Tan Sri Abu Bakar. So I try to be the liaison between the Prime Minister and the external advisory group.
Are you in any way part of the task force, the national task force, or a special committee on COVID-19?
I'm on the special committee for the vaccines. And I, of course, as an advisor to the Prime Minister, I sit in some of the meetings on the Majlis. But as an advisor, you provide advice. I have no operational role, so to speak, to tell KKM what to do and things like that. You've been there in government, as an advisor, you give advice, and is whether they take the advice is another question.
Yeah. Okay, Dato' Sri, can I follow up with another question? Just one more
please,
question.
please. Yes, please.
Okay. You see, I just want to know from Tan Sri Jemilah. You mentioned something about the health reform, especially the public health. I'm quite certain it has been, in a way, derailed a little bit because of this COVID-19 thing. So in the context of basically contagious diseases like COVID-19, what do you have in mind, if you can share with us for the future?
Okay. It hasn't been derailed. I will tell you one thing about Malaysia's health system is it is it is a decent health system. It's fairly resilient, and this is why we've still been able to cope with the amount of stress that we've been having over 1.5 years. It has got preparedness as well. You know, WHO has done an assessment on our health system, and in terms of our preparedness and resilience, it's quite good. There are areas where we can improve. I think our of course, you know, with every health system now, when you have a large and prolonged crisis, you see all the cracks now, you know, where they might be improved. And I think this is a huge opportunity. I don't see this as anything more than a huge opportunity for us to improve. One of the things, of course, if you ask me, is that our health system must not be seen piecemeal. At the moment, you know, you will see Ministry of Health dominating the management of COVID-19, but in a crisis, it has to be a multi-stakeholder management. It must include the private sector. It must include, you know, the military. It must include the NGOs. It must include the private corporations, and everyone has a role, including media. Media has a critical role in providing information. So behavior change is one of the most important things that we need to harness in a large-scale pandemic like COVID-19. Now, I want to give you a comparison. If you hear about COVID-19 in Africa, you don't hear it to be as severe as what we're hearing here today, right? Whereas you and I know how vulnerable Africa is as a continent, you know, but they've been exposed to so many infectious diseases before. And where their strength lies, and I can share with you my experience from my Red Cross days, is that the community engagement is amazing, right? The Red Cross volunteers, the church volunteers, the mosque volunteers, they go down to the communities and they talk to them and they engage with them and they build trust. So when you have that, people will actually change their behaviors. Unfortunately, in Malaysia, our biggest challenge is trust. We have a huge trust deficit at the moment, and it is at all levels. So when you know, even if the Director General tells you something, people may not trust the information, number one. Number two, they will not behave in a way that actually produces the results we need, because they have a lot of mistrust at different levels as well. So this is again why we are, you know, doing badly in the pandemic.
Tan Sri, now we have heard the time frame of 4 months. Okay, now when you look at the numbers, as you said, that it's not just the numbers, but as well as how we're going to cope with the situation. So can we safely say that, look, this is one battle that we cannot afford to lose. We really got to win this fight. And that, look, if we do not win, we are really, really in trouble. This is the last fight. Now, in getting Malaysians to rally, to come together, to change their behavioral pattern, what do you want Malaysians to do to play their part to make this work this time?
Yeah. Number one, as far as possible, try not to move, right? Stay where you are, do your business virtually or online, whatever. You know, and it's easy for you and I to say that. It's not easy for the person trying to raise money to put food on the table, you know, on a day-to-day basis, right? So how can we do this safely? So the other thing, of course, is vaccinations. We know even if we get 20-25% of our population vaccinated, you will see the numbers drop. You will start to see the numbers drop. If we can get to 50%, you will see a drastic drop in the cases. So, you know, we are now, you know, when we started, and again, I want to address the vaccine issue, is that we did not get enough vaccines to start with. I think that we were late in getting the vaccines. We are getting them, you know, sometimes 50,000 a week, 25, that's not enough. Right? Only in June, July do we start ramping up. We get, you know, 4 million, 10 million. That's the kind of numbers we need, right? So when we started, we were doing, you know, a couple of thousand a day and all that. We've managed to hit 100,000 a day now. By June, you know, by the end of this month, we must hit, you know, 150, 200,000. By next month, we need to be able to do consistently 200,000 and above. So I think that, you know, the delivery of the vaccine is going to be important. Having said that, so number one, come for your vaccinations, register and come for your vaccinations. Only less than 50% have vaccinated, have registered. So this is also alarming. If you know, if we know that the exit strategy is the vaccine, then people should be queuing up to register for the vaccinations, right? Now that the volumes are coming in and fast and hard. So therefore our vaccine strategy has to change. So we have to have what we call a ring strategy, which means we know where the high risk areas are. You go in there and you vaccinate them. To me, Selangor, Klang Valley is critical because the most mobile people are from Selangor, Klang Valley. They are the ones who go to Kelantan and everywhere and bring the disease. So if we can just, tackle Selangor and KL, Klang Valley first, we will maybe tackle 60% of the problem. So we really have to, go for these very mobile populations and then go to all the other, everywhere is red now, but where we can actually look at, incidents per district, incidents per mukim and so forth, and then target that. The other thing is we have to see where the spread is happening. It's happening in workplaces, right? So we've got to start vaccinating, the factory workers, the services industry, the restaurants and all that. We've got to, and of course, before we do all that, we have to protect the most vulnerable, which is the elderly, the ones with comorbidities. And that's being done right now as we speak, really ramping up that. So, and then the way you vaccinate, so it's no longer feasible to just vaccinate in hospitals or clinics because number one, they're already overloaded with so many COVID cases. And so you're exposing people to risk if they start going to the hospital or clinic. So this is why we've developed this, what we call the mega vaccination centers, where we can do, for example, at World Trade Center, we can hit consistently 8,000 to 9,000 a day. So that's a lot. So we're also doing this now in Shah Alam, in Mitek. We're going to open many, many more, Sunway and so forth. And then, we also have to get the GPs. They are our little army of vaccinators because there's about 8,000 GPs around Malaysia. So far, about 2,800, I think, have registered. We need to get all of them to register and come on board and then, be our vaccinators. And then we've got to go to people. So I've seen, for example, I was talking to my friends in Terengganu, the health people in Terengganu. They've now done something very clever. They go to these communities, they register and they vaccinate immediately. They don't even wait to give appointment. So opportunistic vaccination now of older populations and so forth. And from 30%, Terengganu now has been able to register 70% soon. So, this really hard work by our Ministry of Health teams on the ground, working with civil society, with mosque committees and so forth. So I think we've got to really just, use whatever way and channel to reach them. The other thing we're doing is that working with KKM, we have... as you know, I come from a civil society background. So we've got Mercy, Malaysian Red Crescent, Zuji Foundation, St. John's, everyone together. So we're going to collate data, for example, those who are bedridden, right? Some of them are either disabled or they have a stroke or something. So I have a mother-in-law who has a stroke and bedridden in Terengganu. And I say to my husband, as long as the people around her are vaccinated, she's not mobile. So, then we can protect her while we wait for someone to come to the house to vaccinate her. So now we are creating this domiciliary vaccination teams as well, going house to vaccinate Mercy and others, so that we can then also tackle these groups that maybe we might leave behind if we don't find them.
Actually, I have a question for you. We always say that this is basically a war. This is a health crisis that we have never experienced. This is the worst health crisis that we have ever encountered in the history of our nation. Or perhaps this is something that we have to get everyone on board. Yeah? But don't you think we need a general in this war, in this fight? Basically someone who is really running the show, not just a Menteri Kanan who has his counterparts or the Ketua Pengarah Kesihatan, who is down in the pecking order. Basically, he has his bosses and things like that. So who is actually running the show? We need a Napoleon, we need a Khalid ibn Walid, for instance, to run the whole show so that everyone, every department, every agency, every groupings of people and pakar and experts and whoever they are will listen to this one particular man. I don't think we have that at the moment. Okay, we leave the Prime Minister aside because the Prime Minister have to run the country. But basically, we must look at a general in this war.
I think just to give you a bit of context, honestly, every week, when I first came back last year in April, we were meeting every day at 8 a.m. every day at the technical level, and then 3 times a week with the Prime Minister. And therefore, it's not for want of not gathering together to make decisions. Um, this is my personal opinion, so I'm not speaking now as an advisor to the Prime Minister. Sometimes consensus is not needed. When you are in a situation like this, sometimes it's very important that your decisions are made by science and evidence. And this is where I think that we as a nation, we've never been confronted with a crisis like this. So I don't blame anyone for sometimes not being able to achieve what they have, because people are just not used to a crisis
Yeah.
of this magnitude. It's very easy for people to criticize from outside,
Sure.
but I have seen firsthand the hard work that is being done. I'm not saying this
Sure.
because just because I sit as an advisor. I'm saying this because I sit with them as well, and I'm also very tired. But every day, we're meeting every day to troubleshoot issues. But again, as I mentioned before, trust is low. Sometimes, instructions aren't so super clear. So I think our communications really needs to improve. And the third thing is that, unless we get these vaccines in fast and change our behaviors, no matter how smart you have as a general, things are not going to change. You can look at many countries in the world where there are strong governments. Germany, still they went through a wave like us. They were also
Yes.
having very high number of cases. This is a once in a century kind of pandemic, right? It will happen more often after this, but it is something that we expect to happen. um yeah, so it's easy for us to complain, but I think for me right now, honestly, I just want to put my head down and focus
Yeah.
on getting people vaccinated, because that's our exit strategy.
Datuk Sri Wong, can I have another question, please? I'm not complaining here, and I'm just putting a fact. Okay. Um, Correct me if I'm wrong. So we are talking about people, individual groups, managing or trying to solve this problem together, which is good. I mean, it's a team basically. Yeah? We need the team spirit and everything. Could there be any possibility of problems pertaining to personal egos, internal bickerings, territoriality issues, and things like that? That might have impacted upon the effectiveness of the whole jihad, the whole crusade, if you like.
I think that, you and I know with leadership, at every level, there will always be egos. But I think we've got to we've got to put that ego aside and deal with the facts and the crisis, right? I think that, as I mentioned earlier, part of the health reform work is the health system is not just KKM. I think this has been a big eye opener for us in Malaysia as well. When it took so long to actually bring the private sector and everyone on board, I kept pushing that the Ministry of Health is a Ministry of Health for everyone, which is private sector, health NGOs, as well as public sector. I think this has been a big learning, because in hindsight, and hindsight is always 2020.
Yeah.
That had we brought on all these different actors earlier on, very early on. The other thing is that we can't keep firefighting without going up helicopter view and really coming up with a clear exit strategy. And this is something I've been really pushing very hard, writing policy paper and strategy after strategy for consideration, because you have the firefighters, but you got to get the big guys to go up a little bit and look at how do we end this. And I must say, our additional challenge is our economic situation. You see, if I was in the US or the UK, where the furlough and all that is not a problem, then that's not a problem. But we have finite resources and finite packages that you can actually give to people, so you can't keep lockdowns are not the solution. You can't go lockdown to lockdown. So we never had that big picture strategy to avoid us going through cycles of lockdown. So I think, and again, I'm stating my personal opinion here, because because we didn't lift ourselves higher to do that. So I would love to see an independent review when the pandemic is over, for the learning that we can get from this crisis, and not to point fingers or witch hunt or whatever, but really we have to learn fast, because this is going to happen again. I don't know, you've been seeing the reports from CEPI. They've mentioned 100 over viruses already in circulation that can be very quickly triggered into another pandemic. Just a couple of months ago, the Singapore government invited me to discuss with them on, they're already preparing for disease X, which is worse than COVID. So, so we've been putting our heads together to think about how do you deal with the next big one, which we anticipate will be worse than COVID-19. So, I mean, yeah.
Tan Sri, I want to understand the purchase of vaccine
Sure.
and how the supply is done. Okay, of course, being Malaysians, we always like to compare ourselves to Singapore, compare ourselves to the US and UK, and we know that the US and UK, because that's where the vaccines come from, and it's quite well reported that they actually hold on to their vaccines for their own people. That's understandable. And of course, in Singapore, through Temasek, they have a big stake in the vaccine manufacturing of Pfizer. Okay, now you mentioned that it came in trickles initially, and then soon in June or July we will have more of this vaccine. Are we at the mercy of these manufacturers? Because I read that, for example, in the EU, they have filed a case against AstraZeneca for late delivery of the vaccine. How much are these delays due to our problem, or because we have no control over how we should get it?
Okay. There's two ways you can get vaccines. One is that WHO put together, I don't know whether you've seen the accelerator access to vaccines. And then together with Global Fund, Gavi, and others, they set up the COVAX facility. So the COVAX facility is a joint facility where countries that are well developed become donors, and those who are less developed become recipients. Malaysia, because we are stuck in the middle income trap, right? So we are unable to get free, but we have to contribute. So we contributed 10% of our vaccine stock to COVAX facility, because it's a little bit expensive, because you have to basically subsidize for the poor countries, right? But it's supposed to be solidarity, but we get 10%. Now, Singapore, you're right. Singapore, Switzerland invested in Moderna, US, Europe, and all that. We did not. And therefore, when you invest, you get first right of refusal. So you get it very, very early. So for us, it's a combination of things, right? I think we started putting in our orders, and I think we did the right thing to spread our portfolio. Rather than put all our eggs in one basket, we put Pfizer as initially the bulk one was 35% Pfizer. The discussions, 10% was COVAX, which could be AstraZeneca or anything else that is approved. The third one was Sinovac. And then we had Gamaleya, Sputnik 5, and CanSino, which is a single dose vaccine. So for Malaysia, our additional layer of complexity is it has to be approved by NPRA, the National Pharmaceutical Regulatory Agency. They're very, very strict, and for very good reasons. But another lesson is we are in an emergency, right?
Yes.
In my opinion, if WHO has approved it, no need lah.
Yes.
Or FDA and all that. But this is Jemilah speaking. So
fair enough.
I think that we've got to think emergency. But nonetheless, it's okay. We managed to get 3 across the line, and then they started to come. Now, when they're manufacturing, initially, of course, the manufacturing is low volume until they can set up many more factories, right? Yeah. So right now, Pfizer, for example, we have increased our portfolio of Pfizer to 70%. And they've been very, very good, I must say. When they say they're going to deliver on this date, they deliver on that date. And so depending on how fast they can churn out the vaccines. AstraZeneca has been slow. Sometimes they
Okay.
tell us this date, they are a bit slow, and we are at the mercy of the COVAX facility. Sinovac, I think the decision for fill and finish is a good one because we get direct also from China, but the fill and finish, you reduce the cost by 1/3.
I see.
And that will be a huge saving, so you can get more vaccines for your buck. And then Sputnik 5 hasn't moved much. CanSino, there's good hope. I think that we might be able to get CanSino across the line. And that's a very useful vaccine because it's single dose. So, for example, for orang asli, orang Penan, all the people, for example, whether they are living in pedalaman or homeless people or migrant workers and all that, probably the single dose is easier. You don't have to go and hunt for them a second time. So this is our portfolio. So when we look at the delivery schedule, the delivery schedule has not been delayed significantly. When they said they're going to give this amount at this time, they have delivered on that time. They only can ramp up that production around June, July. So, for example, Sinovac can be produced at 500,000 per week, so about 2 million per month. So our portfolio of Sinovac will be completed by August. So we will be able to get, a ramp up of Pfizer, a ramp up of everything, so that we can get 60% of what we need by August. So that's a significant number of vaccines. So we in the next 3 to 4 months, if people do sign up for the vaccinations, we should be able to give the vaccinations out.
Tan Sri, that obviously that the Malaysians come first, especially when we have problem trying to get the supply of vaccination. But we know that Malaysia has a lot of foreigners, a lot of foreign workers, whether illegal or legal. Okay, now a lot of them are people that we come to contact with. The helper who comes to our house to clean our house, the person who sends the what they call it, the vegetables at the market, that sort of thing. So how do we get them involved in the vaccination at what stage? Okay, and obviously a lot of them have got little trust in our policies, as you say, that would they get arrested, would the police tahan them, that kind of thing. They're always very worried, but we need them to be vaccinated. What is the plan for these people?
That's a really good question. So this is why we have phase 1, phase 2, phase 3, phase 4. Initially, all the phases are now melting away because phase 2 is important, the elderly and all that, and that's ongoing, right? So I think we can complete that quite soon. So phase 3 is kicking in already. And now because the emerge of the seriousness of COVID-19 in our country, phase 4, which is the strategy to vaccinate because you want to control the pandemic, is already having to come in now. So basically, we have to control the pandemic. So it doesn't matter who you vaccinate, you have to vaccinate people fast. So with the migrants and foreigners, we have been working through MITI. MITI will be talking to industries. So this is where you might have been seeing that the industries are going to start to be vaccinated because that's where the disease is spreading from. Pasar borong, your factories and your makan places and all that, right? So irrespective of their status, if we don't vaccinate them, we still are at risk.
Yes.
So we need to do that. Now, we've been negotiating with KDN, to say, can we please don't arrest anyone till we vaccinate people so that we don't start getting people hiding. And therefore, if they have got positive, and whether we like it or not, they are amidst us. They're the security guards, they're the pasar borong workers, they're the ones, in the mama shop, whatever. They're around us, they're part of our community. And there's this wonderful saying about vaccine equity. Vaccine equity applies to this as well, and that no one is safe until everyone is safe. So we've got to just get a shot in everyone's arm. And we have ordered enough vaccines for 120% of our population. The reason why we have ordered more is, number one, because we have taken into consideration some of the foreigners in this country. But more importantly, we also took into consideration the possibility of children and young adolescents being able to be vaccinated, because 30% of our population are below 18. So for us to get herd immunity, if you take 70% as the cutoff point, every adult has to be vaccinated. And you and I know there are some adults that don't want to be vaccinated. So as soon as NPRA approves the 12 and above, then we can start going for young people as well.
Okay. And Sri, you see, if you look at the figures 10,000 people in Kelantan, another 10,000 people, about 10,000 people in Kedah did not turn up for the appointment. And in Negeri Sembilan, about 6,200, if I'm not mistaken, did not turn up for the appointment. And you know who they are mostly. Yeah? So what is your message to them? What is the problem basically?
Okay, I have two things I want to say. First of all, when they don't turn up, there's always a backup list. So our people on the ground in the States, they have a backup list that they can call, right? Because right now we are calling the older ones. I went to Terengganu. Let me share my experience. I went to Terengganu and I was talking to the pejabat kesihatan and they were saying that when they called this makcik and pakcik, they were saying, oh, anak makcik yang register, because orang register as dependent, right? Makcik tak tahu pun. Tapi nak raya ni, lepas raya lah, that kind of thing. So they are not primed to receive the vaccine. So this is why the strategy must shift. You go, you talk to them, you vaccinate straight away. So that's one. So the backup list, the State Department has, for example, the patients they have in OPD, outpatient department in the clinic kesihatan and so forth, they call them. They also took the measures to just call people who were working in some of the industries around. So as I mentioned earlier, Terengganu has stepped up now. They're very confident. They got 70% from 30% within a month, which I think I really
very good,
respect, right? So we have to do the same. So the other thing we need to do is incentives and disincentives. I think we have to do this. The incentive could be, and this is Jemilah speaking, if you are vaccinated, both doses, then you can cross interstate, no problem. Or if you're not vaccinated, you cannot come and semayang in the masjid. Because that is very dear to our Muslim population, and unfortunately, it is also the Malay population that is lagging behind in the East Coast. But our data is also showing that the Indian ethnic group is also quite small in terms of turn up. So we need to also work on the Indian groups as well to make sure that they are also coming for their vaccination. The other thing is we've got to empathize. It could be because of transport issues. For example, if you are an elderly person staying in a kampung, your son registered you from Kuala Lumpur, you may have nobody to take you to the vaccine center. So all these things now are emerging, all the different reasons why people are not coming, not just because they're anti-vax, but because there are real logistics issues. So now that we have a better understanding, we can start to tailor our vaccine execution, the vaccination, to be able to cater for the context that people are staying in and the situation that we have to then deal with.
Tan Sri, can this vaccination exercise be carried out in the places of worship at the mosques, temples, or churches?
Yes.
Can it be done, right?
Yes. So this is what's happening in UK. I was also, chatting with the UK audience not long ago, asking for advice and all that. Now saying that they were saying in Bradford and in some of the places where there are quite large migrant Muslim populations that they don't come for vaccination. So what they've done now is done the vaccinations at the masjid, at the mosques, at places of congregation that are very dear. This is why I'm saying culture matters, right?
Yeah.
So they've now been able to increase their vaccination rate significantly just by having first of all, the imam being publicly vaccinated and then doing the vaccinations at the masjid. Terengganu is doing that. So I think we've got to get Kelantan and others to do that too.
Would it be a good idea to involve the firemen, the bomba people, and the army people to be involved in this vaccination exercise?
They're all involved. They all sit in our vaccine committee. In fact, the vaccine task force is co-chaired by the number 2 in army and deputy the DG of health. The police are there, the bomba is there, RELA is there, the civil defense is there. You see, everyone is involved. We are going to also start mobilizing, for example, civil servants who are, now working from home. We may tell them that, a day a week or something that they actually work at the vaccine center and help out. And I think there's a lot of, it's a really, really huge exercise. So sometimes for me, I feel very sad. People say, you don't involve these people, and you don't involve. They are there. They're sitting in the committee, they're co-chairing the committee. Okay,
we're running out of time. Johan, can I have one last question from you?
One last question.
Yes.
Tan Sri, I need a favor from you. This is about my fellow comrades, the reporters. You mentioned just now the media played a very critical role in disseminating information, and writing what is perceived as the truth, rather than the fake ones. Yeah? You see, the problem is that these people have been exposed to the scourge, to COVID-19, because they are normally in hotspot areas. They are meeting people. They met the deceased, the family of the deceased. So you see, we among the senior reporters like myself, Datuk Sri, and many others, we have sounded this alarm a long time ago. Why can't the government allocate at least a few thousand doses of vaccine for these people? Consider them as frontliners. In fact, as recent as last week, I wrote in the Star an open letter to YB Khairi Jamaluddin for such, and of course he promised about 6,000 doses of vaccine. But the promises have been met since February this year. Can you kindly inform the very person that you are advising the need to look into this urgently, so that so that my fellow reporters would be doing their work without fear and favor, and they have no worry about being infected or whatever. It's not the total solution to it, but at least there is some kind of insurance policy for them. Thank you so much.
Yeah, Tan Sri, I think you may not be up to date on the information. Already they have been starting to be vaccinated. And in fact, in June, very soon in June, we're already in June, the reporters are already going to receive their vaccine. The reason, as I don't know how many more times I have to repeat this, there weren't just not enough vaccines to, when you think about health frontliners, there's a lot of health frontliners. It's not just doctors, it's also nurses, it's also ambulance drivers and all that, and GP nurses, receptionists. In my husband's hospital, the receptionists were not given vaccines as well, and 9 of them got COVID. So, when we are very seriously talking about when we didn't have enough, we really didn't have enough. And now that we have more, people are going to be given the vaccines. And definitely I have seen a lot of journalists also I know, and they have received their vaccines. Some of them have been calling me to say they received the AZ. Do they take the second AZ? And I've been telling them yes. So I can assure you that they are now on the top priority list, and a lot of them.
Okay, thank you very much. Because I'm saying this, because what happened in Indonesia is that President Jokowi, one of the first thing he did was to allocate those vaccines to journalists. That has been done since early this year. I mean, I don't want any comment about it. It's just that we have been saying this, and we hope things will change from now on.
Okay, Tan Sri Jemilah, I have a final question for you. Now, you mentioned about frontliners. I know of doctors who has already got their second dosage, and yet they ended up being affected positive again. Is this the reason for the nature of their work?
Well, when you're a medical person, obviously you're exposed to the risk very much more than other people. If you look at the data, and I wish I had the data to share with you, the number of cases have actually dropped drastically. About 3 months ago, it was like in the thousands, right? 1,000 plus or 2,000. Now it's only about 73 or something. They do get positive because the COVID vaccination does not 100% prevent you from getting the disease, but none of them have severe disease. Okay. Most of them have very mild disease, and in fact, some of them mild disease, asymptomatic. They can even come back to work very early. Okay. We're wearing PPE because, and that's the important thing. The big message I want to give: the vaccines prevent you from getting very sick, and therefore you don't have to go to hospital, you don't have to go into ICU, you don't have to have ventilation, even if you're old. And this is what we want. We don't want the health system to collapse. We want to make sure that people actually have a mild flu-like illness, and that's what the vaccine does. increasingly data is coming out that some vaccines can actually prevent transmission by about 40, 50, 60%. And that's also fantastic, which means that if you've been fully vaccinated, the chances of you transmitting to someone, even if you're positive, is very, very low.
Thank you, Sri Jemilah, for spending time with us. I know how hardworking the frontliners has been. I know of the frontliners after carrying out hours and hours of vaccination for the Malaysians. They still got to stay back until 9 o'clock to review the work of the day and what they should do tomorrow. I think a lot of Malaysians do not realize this. These are the things that the frontliners have been doing at the vaccination center. So please do have a space for your heart for those people who are doing their work. Sri Jemilah, give me your final word to all Malaysians.
My final word is please, obey the instructions from the DG of Health. You've got to comply to the standard operating procedures. Please get vaccinated. I know some of you will shout at me now and say, well, we registered in February, we still haven't got an appointment. It will come. The vaccine volumes are now coming in, and therefore we can ramp up. And the last thing I will say is that if you have time and you want to help, we need help. And I want to thank so many people who have donated food for frontliners, donated food for those of us working at the vaccine centers and so forth. Whatever effort each of us can do at individual level or collectively is really, really important. We're in this together, right? We want to get some sense of normalcy. The other thing I want to stress is that, yes, the frontliners are exhausted, but the mental health pressure they're going through is horrible. So they will come out of this pandemic quite broken, and I worry about our frontliners.
Thank you, Dr. Jemilah. Stay safe, and Sri Johan, stay safe, stay healthy.
Thank you. Thank you.
To all Malaysians, thank you for following this program. Please like, share, and follow and subscribe RealChunWai, and please follow Dr. Jemilah and Johan on their social media. Thank you so much. Good night.
Bye.